Anyone, John is.
Ready?
Good evening and welcome to another webinar hosted by the Greenwich Hospital Medical Library. My name is Veronica Bitenkin and I'm the Consumer Health Librarian at Greenwich Hospital. The month of April is nationally recognized as Alcohol Abuse Awareness Month. Alcohol abuse is also known as alcoholism or alcohol dependency. And for those who are currently struggling with it, especially during the pandemic, they are part of a very vulnerable population, along with those who are suffering from mental disorders or any other kind of substance abuse, as a pandemic has created situations such as lockdown, lack of social interaction due to the COVID guidelines, and just setting aside a period of isolation that can be very difficult to overcome. So I would like to offer these support resources that are primarily found online that anyone can access with an internet connection, that are created by reliable organizations for the sole purpose of providing health information on alcohol abuse. And we are also going to be going over a resource located right here at Greenwich Hospital, known as the Addiction Recovery Center. And I am happy to be joined by John Tenbush, who is a licensed clinical social worker from that Addiction Recovery Center. Thank you for joining us, John.
No problem. It's good to be here. Thank you, Veronica.
And this will be a recorded session that will be posted on the Greenwich Hospital YouTube playlist, as well as my website, the Dr. Stephen Mickley Community Health Resource section, which a website which is very long, but I will provide a link for at the end of this webinar. So before we get started, I have this disclaimer for all my webinars stating that this presentation is for educational and informational purposes only. Any of the websites and book recommendations and apps that we will recommend tonight, you can definitely peruse on your own time, but always consult your doctor or the healthcare provider for medical advice before making any lifestyle decisions that might impact your health. And all the images that are used in this presentation are sourced from reliable health websites or under the Creative Commons digital license, which means they are free to use. So, broadly speaking, the topics that will be covered tonight are using the internet to find general information on alcohol abuse, resources for treatment, resources for mental health, resources for different groups regarding alcohol abuse, some book recommendations, some mobile app recommendations, and lastly, local and state support resources. And that is where, and John can jump in at any point to offer his expertise on any of these subjects. And we will be ending, of course, with a Q&A if there are any attendees. But about me, quickly, I have been the Consumer Health Librarian since 2019. Consumer Health Librarian, if you do not know, is someone who organizes and evaluates and shares health information on conditions, diagnoses, medications, anything health related to the public, with the purpose of helping them become more informed and thus make better healthcare decisions. I possess a consumer health certification from the Medical Library Association. My 3 pillars of health to my job are health literacy, health prevention and wellness, patient advocacy, and I do care deeply about the residents of this community, as I am a resident of Greenwich myself, and I've been staying sane during this pandemic by walking and listening to audiobooks. Next, I'll let John take over for this slide as he is the guest expert. John, would you like to tell us a little bit about yourself?
Yes, I'm a licensed clinical social worker. I've been working here at Greenwich Hospital since 2012 at the Addiction Recovery Center. Here I run 2 days a week. I do the intensive outpatient program. I also have run several other groups, an outpatient group, which is 2 days a week, and a continuing care group, which is once a week. Previously, I lived in Shanghai for a few years, and I ran the Shanghai Community Counseling Center there for a couple of years. And previous to that, I lived in Chicago for 13 years, where I worked on an assertive community treatment team, working with people who had a severe mental illness and a history of homelessness. And I'd go out in the community and make sure they stay housed and out of the hospital.
That is quite a resume. That's very impressive. And I'm sure there's so many differences in how treatment is in one area of the world than it is compared to here. I'm sure you have a lot of insight, and I'm sure you bring that insight into your practice at Greenwich. So,
Yeah, things they're different and they're the same.
and what would you say would be your motivation for pursuing this particular field of treatment and recovery?
When I first started, I had never run a group before. I'd always worked with people individually. I love doing the group work. Where my job in Chicago, I could see people recover, but it was a slower process. I could see them make changes. Here, I can see changes in people much quicker. And anytime anytime anyone comes into my groups, one of the things I tell them is my ultimate goal is I never want to see them again. That I want, if I see them again, I want to see them in the parking lot of Whole Foods, because that's where I saw one of my former patients. But most people don't want to be here, so let's figure out a way to be able to live your life so that you don't need to come back into this program.
Well said, John. Well said. And we will be talking about group therapy and counseling as a treatment throughout this presentation. So we'll look forward to hearing more about that from you as we go forward. So just to provide some context on just where alcohol abuse in the US is, statistically speaking, and to define it, according to the National Institute of Alcohol Abuse and Alcoholism, NIAAA, it is defined currently as a medical condition characterized by an impaired ability to stop or control alcohol use despite adverse social, occupational, or health consequences. And based on this picture onto the right, that is based on a spectrum of mild, moderate, and severe. And based on that website also, I gathered that it is considered a psychiatric disorder. It is listed in the DSM-5, if I'm not mistaken, John.
You are correct.
And it is diagnosed based on 11 criteria or displaying certain symptoms in a 12-month period. And I'm assuming that's just part of the intake assessment that you have to do for patients when they come in.
Correct.
And I did notice in the website that they make a distinct notion between binge and heavy drinking, and that they're saying that just because you drink heavily does not necessarily mean that you have alcohol abuse or alcohol dependence. Do you mind explaining a little bit more about that distinction, John?
So like heavy drinking, what we're looking for, especially in the assessment and what the criteria, 11 criteria, is what are ways that this is going to impinge on someone's life. Some people are able to be able to continue to function, take care of their job, take care of their family. They're not thinking about having a drink all the time, and that it's not a problem in their life. Whereas someone who has a problem, either they're getting behind the wheel and driving, so putting themselves at risk, drinking on top of medication, which can put yourself at risk if you spend time just thinking about wanting to have a drink and planning to have a drink. That's sort of the craving that comes that we're looking for, and those are just a few examples of what's going on there.
Yeah, and I'm sure you've had patients try to tell you that, oh, my heavy drinking is not alcohol abuse. So
right, or I can control my drinking. I'm only binge drinking. But it's the binge drinking is a false sense of control, in that once someone starts drinking, they drink until they can't stop, and they still would hit all the other criteria because they're not taking care of their family during that period. They're putting themselves in unsafe situations. They hit other criteria there.
So even if it is distinct from it, binge or heavy drinking can definitely lead to alcohol abuse.
Correct. Yes.
Yeah, that's really important.
And sometimes even heavy drinking can lead to dependence itself, that if they were to stop drinking, they could have physical effects from how much alcohol they have been drinking.
And based on a 2019 national survey for drug use and health, they reported that as of 2020, there's close to 18 million people ages 12 and older that have an AU an AAD, an alcohol abuse disorder. I have AUD down. That must be different. But
AUD would be alcohol use disorder.
Okay, alcohol use disorder. I put alcohol abuse disorder, my mistake. The numbers of 18 million, that's ages 12 and older, which was pretty shocking to me that someone that young can develop an AUD.
The average age that we see for people reporting that when they first start drinking or using drugs is usually around 15, 16.
Mm-hmm. I would assume it would be closer to college age, but I guess children and teens have access to alcohol just as much as a college student might.
Yeah. Yep, you're correct.
It's sad. Yeah. And it's alcohol dependence that only grows when it's older. And I'm sure a lot of it starts out when they're young. So in general, what the website also lists is certain health effects of prolonged alcohol abuse, which includes liver disease, fatty liver cirrhosis, cancer, not just of the liver, as you might assume, but also of the brain, of the throat. Can also lead to heart disease, increased risk of stroke and heart attack, brain damage, and also various immune system disorders.
Yeah, there's recent research showing that any part of the body alcohol touches is at an increased risk for cancer. And I think the New York Times just had an article saying that there's talk of putting warning labels on bottles of alcohol, just like there are on cigarettes, because it's just as much of a cancer risk as
I heard about that. Yeah, I personally hope they go through with it, because I think it's important.
Yep.
And then we have fetal alcohol spectrum disorders. I'm sure people have heard of fetal alcohol syndrome, where it will affect if the mother is pregnant, they will affect the development of the baby. But there's actually more than just fetal alcohol syndrome. It's a whole spectrum of fetal diseases. So, and last but not least, we have in general just an increased risk of death from car accidents, suicide, or other injuries brought on by heavy drinking, as it can impair your mind and thus impair your function.
Yeah, we have a lot of people that they come in because they have a DUI, and a lot of people just report that they've driven drunker many times before that. They just happened to get caught that time. They didn't think they were drunk, but we even have people who drank the night before come in for an assessment, and they're still legally drunk when they come here because they drank so much.
Goodness,
right?
wow.
People don't realize just how it can affect them.
Yeah, I guess they become so used to it that it just feels normal to them.
Right.
Yeah. So if you're somebody who only knows Google as a source of finding information, that's totally fine if you know how to research it. But most people, they type in something like alcohol abuse, you'll get billions upon billions of search results. And that's going to just make your research even harder if you're looking into knowing more about this yourself. So I recommend always Medline Plus. It's one of my favorite general information databases. Just quickly show you what it looks like. So this is their page on alcohol use disorder. And I'll show you how to get to it from the homepage. You should just log in from the homepage. It's very simple. It's a whole list over here. You go to health topics, you go to disorders and conditions in the center, go to substance abuse problems, and then alcohol use disorder is right up at the top. And what's different about this is that unlike Google, where there's just a bunch of results that aren't very organized, this organizes it specifically on what you're looking for. So if you're looking for prevention risks and factors, you go right down to it. And I like to call this database a gateway database because each page of each condition that it talks about links you to a specific website that is part of that category that you're looking at. So it'll directly take you to the alcohol treatment navigator on the National Institute of Alcohol Abuse and Alcoholism. So if you didn't even know that organization existed, now you do, especially when it comes to finding information about treatments and therapies. And they come with health check tools down here, statistics, clinical trials, and everything in here is very well reviewed and updated, and everything's checked out in multiple languages. And it has even related health topics on the side here. It's just very pleasing to the eye and just very easy to read and understand and use. It's a good beginning step for anyone who wants to do independent research. And then next we have my website, the Dr. Stephen Mickley Community Health Resource section. As I promised, here's the link so that you don't have to remember the very long title and look it up yourself. We have a whole section right here under health topics. You go here to substance use disorders, and this is the page. This is what it looks like. So all the organizations that I will be mentioning tonight are on here. We've had a section just for teens. And when we have addiction recovery right here at the top at Greenwich Hospital, if you want to get in touch with treatment, we're there right there. And then just quick links to various pages on different websites that would be helpful for people to start. And a section for the books that are currently in the library regarding alcohol abuse. So the first website, and I've mentioned this already several times in the previous slide, the first website for general information on alcohol abuse is the National Institute on Alcohol Abuse and Alcoholism. You can't look up this stuff without going here, because all of them kind of connect to each other, and almost all of them reference this website as where most of the information comes from. This website is shared for both consumer information and healthcare professionals. So for consumers who want to look up things on their own, mostly stay on this side of the board. Alcohol basics, you've got your overview of alcohol consumption, standard drink, just a general page on alcohol use disorder, which is where I got most of the information on my first slide. And they have all their sources written down here. This is how most of the articles on here look like. And we will be going over this later, but we do have a section on here for special populations, such as underage drinking, information for parents, for how to talk to your high school grads about celebrating safely, college drinking, planning for older adults who might have it, drinking during your pregnancy, and even alcohol in the Hispanic community. And last but not least, they even have the option of ordering pamphlets and brochures, fact sheets on any of the information that's on here, so that if you'd rather have it in print right in front of you, and if you don't have, or you have a really bad internet connection, you don't want to have to keep relying on the internet to go on it, you can just order these, and these are for free, although the limit quality is 50. So, and then getting help this is a really good resource for just figuring out the steps and to finding treatments, what options there are, and how to select the right treatment for you, because as John will go into detail later, there is a lot of steps to figuring out what kind of treatment you need, the costs of each treatment, and what's going to be most effective for everyone, because not everybody has the same experience with alcohol abuse, right?
Correct. Sorry,
Yes.
just writing down a note there.
Yeah, not to mention that there is the section on just medications regarding it. So there's the tips for how to select it. There's an ongoing process. There's tons of resources on treatment, not to mention that the premier source for figuring out a treatment option is right here under Find Alcohol Treatment. It takes you directly to the NIAAA Alcohol Treatment Navigator, which is literally a step-by-step guide on how to, for one, search for trusted sources to find providers, asking specific questions when you find that provider to see if they're right for you, and how to make sure that you're choosing the best quality care for alcohol treatment. And we'll be going over this website more in detail in a few more slides. I also want to draw attention to Rethinking Drinking, which is also a part of the National Institute on Alcohol Abuse and Alcoholism. This is more catering towards if somebody wants to know personally what their patterns are, what their drinking levels have been. You know, it's kind of like sort of like it offers a lot of symptom checkers for yourself, but they also just have general information like what are the different drinking levels, what are the risks, So very, very short, very easy to read paragraphs on just basically summarizing what the National Institute on Alcohol Abuse and Alcoholism has already stated. But they do have a great section on treatment. Not only that, but they have strategies for cutting down. They have the support options for quitting. The pros and cons for making a change. They use that in the form of worksheets, which would be under tools. So they have over here interactive worksheets and more, as well as calculators, as in calculating how much alcohol is really in your drink, how many calories in your drink, what's the cost to you per week, per month, per year. For some people that might help. I don't know if you use these much often in your practice, John.
The calculator, several of our patients will use that, and they're always amazed at how much money they're saving by working on their sobriety.
It's probably quite a shock, right? Yeah. So they can actually go online here and actually do it on the computer. So that might be simpler than just having them print out something from home. They can just quickly do this whenever they would like. We also have calculators for drink size, calories, blood alcohol content calculator. I think a lot of people will be surprised at how much weight they'll put off just by like not drinking as much. So that could definitely be a benefit for some people.
Yeah, the drink size sometimes can be important. I met with one person and she said she didn't have any problem. She was just drinking 2 drinks a night. And I asked her how she made those drinks. And she said, I put 5 shots into the glass and add a little bit of soda.
That's quite a lot.
You're having 10 drinks a night.
Basically. And then last but not least, for general information, because alcohol is considered a drug, we have the National Institute on Drug Abuse. And because it is sharing with a lot of other substances, we do have this one section here on alcohol where they have, they do connect to other sites that we'll be talking about later, but they also connect to a lot of great facts about treatment approaches for drug addiction, lessons from prevention, and it does share a lot of resources with healthcare professionals that might access it. But you can definitely go into these news releases and news and events to see what new updates have been with regard to treatment for substance abuse. And then various studies can be printed out. If you're an educator who's trying to educate like teens, or you're a parent who wants to educate their teen on, the typical, on the National Drug and Alcohol IQ, for instance, you can definitely print these out and and have a good conversation with them. See what they already know, see what their gap in knowledge is, that kind of thing. So we're moving on to resources for treatment and management, and I already mentioned this several times. Can't get any better than the NIAAA Alcohol Treatment Navigator. And like I said, it goes over like the steps of how to find alcohol quality treatment, but they do have a section on just general information as well. Very neatly organized, no sponsored ads, as you can see. And they even let you rate how helpful the pages are, which is really nice. And look at that, they're even referencing something we already talked about, the Rethinking Drinking page. And they already talk about the 2 main components of professional-led treatment. Talk therapy. A licensed therapist such as John would help people build coping strategy and skills to reduce drinking, along with potentially any kind of medications that may be needed. And over here, they already talked about the 4 basic levels of care: outpatient, intensive, residential, or intensive inpatient. And even with regards to cost of insurance, which may be a barrier definitely for some people, they have a whole page just on that. So you can see. So the guide here for the steps to search for providers, you can go in here, learn what to ask, learn how to choose the care. You can even have certain support through the process, to what to expect before, during, and after treatment, being able to manage expectations, understanding that relapse is an important part of the recovery process, which I'm sure John can tell us a lot about, and long-term recovery support. How crucial, John, is having a social group or support system at home for recovery?
Having social connections are one of the key things for recovery. Just a majority of people are either drinking or using drugs in isolation. They don't want others to know. And so being able to make these social connections and be able to understand that there are other people that are like them and have been able to work on improving their lives, uh, uh, allow someone to make the changes in their lives with that improvement. But it is so important to have the social connections, because if someone was to go to their spouse and say, I'm thinking of having a drink, the spouse's first response is going to be, here we go again. Whereas if you go to someone who's also in recovery and you say, oh, I'm thinking of having a drink, and like, all right, let's talk about it. What do we need to do? And it's not that you need to talk about it, get it out of your head. Because that's one of the biggest things that I hear is when someone's able to talk about what they're actually thinking, that a lot of times that urge to drink goes away. But when they have that ping pong game in their head and they're like, should I drink? Should I not drink? It goes on for hours. And then they talk about it with someone else, like, no, I'm much better now. I don't need to, that's not what I want to do.
Yeah, it seems like the group therapy is a judgment-free zone in a way. And because you think that the judgment would make them less likely to do it, but it'll intensify that guilt that they feel and therefore make them want to
And
drink
there's
more.
also, as someone continues to work on their recovery, the group or those social connections help to make them accountable. Like, oh, I don't want to let down these people. So those are always things, whatever different ways we can get more accountability in there, help someone learn how to live their life in a new way.
And even if it is difficult for the person going through it, it is also can be difficult for those people in their life who they love but are suffering from it, which is why I'm glad that this website also has caretaker support resources, support for family and friends of the person in treatment, because their well-being is also just as important, because if they're not well, then their person that they're trying to take care of won't be. So we also have the frequently asked questions section. And what I really like is that they put together this entire toolkit in a downloadable PDF that anyone can print out and have all of these individual worksheets that would be good for those who want to organize all their choices for treatment. They can just type it in right here, or they can print it out. They can have a set of 3 choices, 3 doctors, and when they go see them, they'll know what questions to ask and what pertinent information they need to remember. And then we have it for each section, for choosing quality care, for the asking the recommended questions. And some of those recommended questions, according to this, would be basics, payment options, other health issues, living situation. Just not only is it important for them to know, it's important for the licensed therapist to know as well. Do you think something like this would be helpful to your patients, John, or anybody who's looking to know more about your services?
It's definitely could be helpful to have. As I'm seeing those, these are definitely questions we ask during the initial assessment.
Okay, so it's in a way it will prepare someone to answer them before the assessment.
Correct, yeah.
Which is always a good thing. I think it'll make the meeting a lot more productive and less time consuming as a result. So I always advocate for patients to be more prepared for those meetings, because unfortunately people run out of time.
Yeah, well, it's just like anytime you go to see the doctor, you have all these questions for the doctor, and then you see the doctor and you forget them all.
Exactly. I actually looked it up, and the most time that you're going to have with the doctor on average is 15 minutes. And there's a lot to talk about in those 15 minutes. So
it sounds about right.
It's good to narrow it down. So the modules and worksheets from Rethinking Drinking, I've linked again right here. And we also have SAMHSA's treatment services locator, which I'll show you right here. The Substance Abuse and Mental Health Services Administration has a search database where you can type in your city or address and be able to locate whatever treatment centers are closest near you. If I typed in Greenwich zip code, I'm sure Greenwich Hospital's Addiction Recovery Center would be at the very top. And then
That's a very good website. In fact, the manual we use for intensive outpatient, you can, if you searched Matrix manual on the SAMHSA site, you would find the manual that you could download it for free from here. That's what we do. We just download it straight from SAMHSA.
Great. So if a patient wanted to know more about how you actually run your services, then they can actually access it themselves. That's really great.
Yeah, and SAMHSA, I think, has their own YouTube website too. With there's some of the videos that we use that Hazelden puts out that are very expensive to buy, but they put out a version on YouTube through the SAMHSA website.
That's such a great service like that. So, and in addition to this services locator, they also have findtreatment.gov, link to their suicide prevention lifeline, the national helpline for treatment, referral, and information, and the disaster distress helpline. And we will be referring to SAMHSA shortly in the next slide, I think. So I might as well actually keep this up. Because, yep, that's the first one up. For our resources for mental health, we have SAMHSA, the National Institute of Mental Health, and I've put up their national helpline once again, just as a reference for people. My mistake, hold on. Let me get to that page. Okay, so we can get to SAMHSA's homepage this way. So you have find treatment here. So you got the services locator, the treatment program locator, the early serious mental illness treatment locator, just the treatment locator specified by what exactly you need treatment for. So that's really great. They have public messages to help prevent suicide, knowing the risks, resources for families coping. Is this where the where is their access to their YouTube page? Is it somewhere here, John, or do you have to physically go to YouTube?
I've always just gone straight to YouTube and type in SAMHSA Matrix manual, and
Okay.
it brings it up.
Perhaps it would be under View All Programs. It might be under Programs, but separately, yes, you can definitely go on to the YouTube page and just look up SAMHSA right there. And they also have newsroom press announcements for coronavirus and publications that you can also get online. We have substances. I'm sure that if we type in alcohol in there, that'll pull up a lot of resources on that. Anything else you would recommend from this website, John?
No, SAMHSA is the clearinghouse for all the information. There's a lot of stuff there. Just different manuals for understanding different parts of substance abuse, and just and different ways to work with how to address certain problems, how do families deal with it. Sometimes it's overwhelming how much information SAMHSA has.
I agree. Just looking at this, it's a little bit intimidating, but I think I actually found some of these videos that you were talking about right here. So I guess if you, in each section, in, for instance, public messages, they might have incorporated a video or two in each one. So at some point, you're going to find one of those videos in here. So as you can see, it's kind of formatted in the same way as the Medline Plus, where it's pretty easy to read. It's no ads anywhere in sight. So it's not going to be distracting. And so you can see it's related to a variety of other sources. So very great website, a lot of great information in it. And we have the National Institute of Mental Health because we all know that how closely alcohol abuse is tied to mental health because of addiction. And we got the health topics section right here. Go over all of the specific disorders that may result out of alcohol abuse. We got the anxiety disorder, depression, just all that information that could arise as a result of alcohol abuse. Because if, John, correct me if I'm wrong, if we discussed earlier that alcohol might be a coping mechanism for these disorders, correct?
Correct. Yeah. Someone's having anxiety. They don't want to feel anxious anymore. So let me have a drink so I can escape. Or I'm feeling sad or I'm feeling angry. I don't want to feel that way. Let me have a drink.
So perhaps someone might benefit from finding information directly about the source of their addiction, which might be one of these disorders. So If that's the case, then this is the website for you. They also have treatments and therapy section, a special population section, even a section on clinical trials. And they also have education and awareness section where you can browse by topic just directly over here. And they also have news and events. So this is also shared with healthcare professionals. So they do have press resources, research highlights, and any kind of new updates on treatments and what's new in the world of mental disorder. So you can stay up to, anybody who's looking into it can stay up to date on what's new with regard to treatment. So next we have a bunch of different websites for resources for different groups. For instance, if you want to look up specifically for, again, we have National Institute on Alcohol Abuse and Alcoholism. So we had that special section just for special populations, but there's also, if you want to specifically look on alcohol abuse for the elderly, we have the National Institute on Aging. They have a whole section on facts about aging and alcohol. You can also order free publications on that subject as well. Nothing too different from the alcohol abuse, National Institute of Alcohol Abuse and Alcoholism, but it's specifically geared towards that particular age group.
Yeah, one of the things with drinking when elderly is one, the drink, if you're drinking too much, you're going to lose your balance. So you'll see someone who's elderly having more falls. And the other thing is it can also make people more confused. We had one person, he drank socially all his life, retired from one industry at 60, started another job and worked that until he was 80, and continued to drink all his life. Within 6 months of finally retiring at age 80, he was in our program just because he lost that structure in his life. Drinking in the morning and just realized that he was forgetting things, falling down all the time, and that he needed help.
Yeah, I wouldn't be surprised if that wasn't mentioned in a healthcare provider setting. They would have described him as having some kind of dementia, but it can result as a result of alcohol abuse. So that's a really good point. Not to mention, as that I clicked out of there, but the National Institute of Aging does mention how certain interactions with medication can be pretty devastating and deadly. So
yes,
that's also good to keep in mind. So good point about the fall prevention though. So next we have a really relatively known website that college students and teens may get a kick out of. It's Go Ask Alice. And it's basically a question and answer generator where these students and healthcare professionals from Columbia University got together and just made this so it's a safe place for teens and college students to ask questions about alcohol. So if you go to health topics, you go to alcohol and other drugs, you can sort out specifically alcohol, and you'll see a list of questions that were asked by students. They can be very interesting to look through. But it's something that teens and college students might feel like they can't ask a regular person without coming off as having a problem, or might be embarrassing. So this is a great way for them to ask a question without feeling that embarrassment or shame. So, and it's something that's answered by professionals at Columbia University. So it is something that will be, not reliably answered. And all these answers have links to those organizations that we've talked about already and more. So this is a great resource for teens and college students, like I said. Next, we have what's really good for parents of somebody who is going through a substance abuse disorder. This is the Partnership to End Addiction, Catching It Early. We have resources in Spanish as well. This is general information that can be found about teen substance abuse. Not to mention, they also have a treatment and recovery plan. Finding treatment, navigating the treatment system, kind of a similar vein as the treatment navigator that we showed earlier, but geared more towards that specific population of teen and child. They even have a section just on treating opioid addiction, which has become more and more of an issue. Have you heard of this site, John?
No, I think I've heard the name, but I've never been to the site. I'm actually been writing down a few of these websites for myself to go back to take.
Oh, well, that's good. I'm glad that I'm telling you something new. But yeah, so I don't know what the age range of the people allowed to be in your patient intervention program, but this could definitely help a parent in need who may not know what to do for their child.
Yeah, we work with adults only, so 18 and above.
But are parents able to consult with you guys, not necessarily be involved, or?
Well, if the patient's here, we always want to do a family session of some sort because it's highly important. Not always does a patient want their family involved, and we try to work on that to see what are the reasons are for that. But yeah, we definitely want to work on those family connections because it is very important to. We know with addiction and alcoholism that the lines of communication get broken, and we try to provide a safe place to allow people to start talking to each other. And sometimes it's educational for the family members to realize, because they'll say, why can't this person just stop? Well, it's because they're dealing with a disease, a brain disease. The brain's been changed. And that they're talking to the alcohol, they're talking to the drugs, they're not talking to that person. So once they realize that you're dealing with the disease and we got to work on making changes, that it starts to make sense for some people that way.
Yeah, and having them create that social network once they understand what's going on. So of course, that's very important. So yeah, this is the special population of parents. That's what this website would be really great for. And then last but not least, we have the National Organization on Fetal Alcohol Syndrome, which would be beneficial to the special population of soon-to-be mothers or those who want to know more about just how much alcohol would affect their baby if they ever become pregnant. This would be the site for them. They have help and resources. So they mention, of course, a lot of the places we already talked about. They also have tools for parents and caregivers, resources for adults who already have this syndrome. So because it does affect mental and brain development, they will need a lot of help navigating through life. So there are resources for just those adults on this site, which I think is really great. So as you can see, they have the leading resource, and so they also have facts sheets, expectant mothers section, light drinking during pregnancy, diagnosis, living with it, adults living with it, education, just all sorts of great information just on it. And just the recommendations for every single website that's reliable about it. They even have the alcohol and pregnancy science just describing why it exactly does affect that baby. So just it's a topic that's not talked about enough, but it's something that is really valuable to know more about.
Yeah, it's very important to know that.
Yeah.
For the health of the child and the health.
I have a feeling it's like a taboo topic for that reason, but it's the more you know, the more you can prevent it from happening. So that's why websites like that are very important. Next, so we've gone over all of the online resources so far. I know it can be overwhelming, but definitely look at them in your own time, see what works for you. In the meantime, we also, for those who prefer to be into print resources as opposed to just being on the internet all day, we have two book recommendations, one of which is currently at this library, at the medical library at Greenwich Hospital. Once the visitor policy is not as strict, you are able to borrow this Mind Book Workout for Addiction by Stanley H. Block. There's a lot of people involved in this, but the guy that's most connected with this is Guy du Plessis. I think that's his name. And he, it basically is a bunch of exercises within the book that help you get to the mental side of the addiction. So it helps you learn how to regulate emotions, uncover what your triggers are, and just be able to manage your emotions to the point where you're not using alcohol to cope with them. So really great book. I've had a lot of people check this out before the pandemic, so clearly it works. Have you heard of this book, by the way?
I have not. I've heard of different, the general style of it, especially the mind-body connection. I mean, that's the general thing that we're looking at is being able to recognize how you're feeling. What is your emotional state? What are you feeling physically? And if you can recognize those early warning signs that you're wanting to have a drink, then you can start creating space to do something different. But so often people don't realize that they're moving towards having a drink until they're already at the liquor store. But if you can recognize, I haven't eaten today, I'm hungry, that's what I am, let me have something to eat. And then you can, because one of the acronyms we use is HALT: hungry, angry, lonely, tired are some of the big warning signs for people. So there's definitely, the more you're aware of your feelings, of how you're feeling, anytime I start my group off, each person's got to identify how they're feeling, and I can tell you, they can say good, fine, or okay, and I'll say, all right, that's fine, but how are you actually feeling?
Mm-hmm.
And I'll hear someone say, oh, I'm good, and I'm like, how are you feeling? Like, well, I'm actually angry. I'm like, all right, that's what we got to figure out. What's going on? What's making you angry? How do you want to respond to that? So.
Yeah, you want to make it not as vague as possible, because then they can't like focus on it and narrow it down to like what exactly I need to fix. So yeah, just I think that's what's also great about this Mind Body workbook, is that it really goes down to the heart of what's the issue and not making it so vague. So that's
part of it. You're trying to create a new way of living, because you have your old neural pathways that lead you to drinking, so you got to create new ones. So you got to create a new way of thinking, new way of being aware of how you're feeling to live a new life.
Basically get to know the emotional side of you. Yep.
Yeah.
So, and then this was one that you recommended to me very recently. It's called Burnout: The Secret to Unlocking the Stress Cycle. It was published basically right around the time of the pandemic. Was very close to happening. So kind of a great time for them to release this kind of book. So John, you can definitely fill us in on what's so great about it.
Well, I listened to a podcast recently with Brene Brown interviewing the two authors, Emily and Amelia Nagoski. And they talked about how stress is a bodily response to stressors, and that you need to be able to complete the stress cycle. And when they listed the 7 things to complete the stress cycle, a lot of those were the same things, same coping skills that we look at of how are you able to deal with your own triggers. And so those, the 7 things that they offer is, to complete the stress cycle is doing some type of physical activity, doing breathing exercises to calm yourself down, having positive social interactions. We've already talked about that several times tonight. Being able to just have laughter, being able to have affection with another person, where it's not where you have, they say, talk about a 20-second hug where you just feel connected. Again, that social connection with someone else. Just being able to cry, just let it out. A lot of people are afraid to cry, because almost like with anger, they would feel like things are out of control, but they're saying, allow yourself to cry, and then just focus on what you're actually feeling with the crying. That your snot's coming out of your nose and everything's going bad. But if you start focusing on those physical feelings, that the crying will stop. And then also the creative expression. So some people in dealing with stress can do, like one person, her son had died and she was a dance instructor. So she created a dance in memory of her son. And that was a way of creative expression for her. They also mentioned how one person, physical exercise wasn't working for him. They would do it, but it didn't have the same response. But she imagined when she was on the elliptical that she was like Godzilla crushing the things that were giving her stress. And that creative expression allowed her, she felt better after doing with that. It was just being able to use that imagination. But it was just really interesting to see the correlation between what we do here in the Addiction Recovery Center and then also to deal with stress. Because a lot of times drinking or drug use is a coping skill for stress.
And I think right now people need to know about this stress cycle and coping mechanisms more than ever. And I for one know the benefits of a good cry. So I will definitely I will definitely point to the fact that it is so stress relieving once you have a really good cry. So I highly recommend that one. And we have a book list that I found from the Addiction Resources website, because not all want a book that's about stress, or that's kind of like under the label of self-help. So some of these on this book list are just ones about fictional things. So let me just get down all the way to where it is. I think I put down the wrong page. Yeah, okay. So this is the wrong site. But if you go to your local library and just look up anything along with alcohol abuse, there is a ton of biographies about from celebrities who've been alcoholics their whole life. Feel free to get your inspiration for recovery from not just a self-help guide, but from somebody else's story, or from somebody's biography, or even just a fictional account of somebody recovering, because I don't think that people should just be pigeonholed into just the self-help section. So
Yeah, there's Russell Brand is in recovery. He's got a book called Recovery. There's also Liz Vargas, the ABC News. She has a book out about her recovery. There's a lot of famous people who have their books about recovery that or will talk about how they stopped drinking. If you look up Stevie Ray Vaughan, he was in AA and he talks about his story. You can look that up. That someone was able to record that. So there is a lot out there about people just telling their stories for recovery.
Mm-hmm. So whatever source works for you, these are just the recommendations we have. But that there's a book list out there for you, and your public library most likely has those kind of stories in a specific section. So you can definitely check that out next time you're able to go to the public library. Next, we have mobile app recommendations, because we are essentially carrying these mini computers in our pockets. Health apps have become one of the number one type of app that you're able to access now. They used to be created just for healthcare professionals, but now they're actually used and available to the everyday consumer. Most people are familiar with apps used for weight loss and, just fitness in general, but there are apps that are catered specifically to recovery for alcohol abuse. One of them I found online is Sober Tool. That's the logo for it. It's a variety tool developed by a Harvard-educated addiction counselor, and it kind of works in the same way as a food tracker, in that it sends you motivational messages. It'll give you notifications and milestones to help you track your progress. And it even has a chat forum so you can connect with other people who are also in recovery. A similar one to that is I Am Sober, which is the logo for that. It goes a little bit into more detail with regards to keeping track of sober days and milestones. Not only that shows progress, but it also shows your withdrawal timeline. And just like with those other websites that we talked about, it is able to show you how much money you have saved by not buying alcohol, or how many calories you haven't consumed because you've been drinking. They also have a kind of a reward system where you can make like certain pledges and get a reward as a result. And once again, it also has it has community members and a social networking feature on it, where not only you can, comment on everybody's recovery, you can also set up a private support group with the people that you like, that you find on there. But it does not, like we said with the books, it does not have to be specifically about alcohol. It does not have to be the primary focus. I was made aware by John about a specific mental health app called What's Up. And John, would you like to tell us more about it, as you told me that you actually suggest it to your patients?
Yeah, it's a great app. It gets confused with the WhatsApp.
Yeah,
It's
I can
sometimes
see
it's very
that.
tough to find, but it's a great little thing just to, because when you open up the app, you can the very first thing it'll give you help right now, and you can click on that, and then follow that to whatever type of help you need. It'll list coping strategies. It'll give you information about anger, anxiety, depression, self-esteem, and stress. And you can have there's a personal area where you can have your own diary, what positive habits, what negative habits, and your own notes. So it's just a really helpful app, I find, especially the idea that, because we're always looking at, a lot of people, the drugs and alcohol are their coping skills. So if we've taken that away, we want to look at what are new ways to cope with whatever's your problems are. And so this is at least one way to have right in your, very quickly, like, all right, what is a coping skill again? What do I need to do? And you just take a quick look and like, oh yeah, I can do that. I know how to do that.
Mm-hmm. Yeah, as it seems to be described here, it's us utilizing some of the best cognitive behavioral therapy and acceptance commitment therapy, which I'm not familiar with, but it apparently uses these methods that are commonly used in counseling and therapy right in your phone. So I don't see how it could not help someone. And it seems, just from the previews alone, it seems pretty simplistic and easy to use. So,
And it's free.
and which is really great.
Yeah.
Especially that a lot of these mobile apps provide the access to care that you might not be able to get otherwise in a free setting. So it's definitely one to look out for. We also have Dr. Judd Brewer's apps for anxiety, quitting smoking, and eating healthier. I'll just show you quickly here what that looks like. So these are the two that are listed here: unwinding anxiety, eat right now, and to quit. So
So yeah, Judd Brewer is a neuroscientist who specializes in addictions. He
yep, this is
is
it.
also very much mindfully based. And he's showing how meditation can help with people, but he also looks to see, how do you change your habits and how do you change that reward system for the habits. So it's sometimes it's understanding that someone's drinking has become a habit. So how do you change that and lessen that reward, where people think that, oh, I like to drink because it makes me more social, when actually it's just the opposite. And realizing, all right, it's again, you're looking at new neural pathways you're trying to create. You want to look at alcohol in a new way, not romanticize it.
Mm-hmm. So not only does his website include those apps, he also includes a link to his book, his TED Talks and videos, and all sorts of different programs that probably just promote all the same things that you just spoke about. So
Yep.
that's something to look into.
I'll use some of his short videos I'll use in my group setting just to get points across about how to change habits.
That's even better. Yeah, just if it can't be said any better, let him say it,
Yeah.
So yeah, I like the fact that it's not, you don't have to go just to the app store and look up alcohol abuse. You can just look up a meditation app or something that's supposed to be for stress relief, because it's of course that makes you have to look through more apps and have to search more, but it's good that there's a broad range that people can try out.
Yeah, and he also has in there a link to his podcast with Dax Shepard. Dax Shepard's married to Kristen Bell, and Dax
Yeah.
Shepard is also in recovery. And there's an interview with Dax Shepard and Judd Brewer where they talk all about addiction, what goes into it, and what's needed for recovery. It's a really fascinating 50 minutes or so.
And for those of you who are looking at what was rated the best alcohol addiction recovery apps of 2020, we have a link right there for you. So those, Sober Tool and I Am Sober, were both on that list of the top two. So you can definitely check out the others if you'd like. Then we have state and local support services that I was able to find online. The Connecticut Department of Mental Health and Addiction Services has their own page. That's their logo. So if you click on here, you'll go directly to that website. There's also the Connecticut Community for Addiction Recovery, where they have webinars. They have their own 12-step program that they recommend to people. And then we also have United Way 211 CT, which is its own sort of behavioral treatment locator. So if you type in the zip code, you'll be able to find something like Addiction Recovery Center right at the top. So it's a locator specifically for Connecticut.
For CCAR, I just want to mention that they're a great program. That they do a lot of great work, and they offer, one of the things that they offer is you can go to their site and you can fill out a form, and you can have someone in recovery give you a call once a week or whatever you want, just to talk to you, so you can have someone who's going to check in with you. And they've also, there's a documentary out there called Anonymous People that they were a part of in filming that.
Oh, I had no idea. Yeah, it was on HBO, right?
A few years back, yeah.
I think on the website when I looked into it, yeah, I saw that it was there was a documentary on there. So you'd recommend that for people to view?
Yeah, it talks about trying to break the stigma of addiction, and that's where CCAR has like a recovery walk where they, across cultures, 5 to 10% of the people will have some type of addiction. And so that means there's a lot of people that have addiction, but there's a lot of people in recovery, and they're trying to, one of their focuses is to help show that there are people in recovery. It's not just certain people, that it goes across all boundaries. And they also they do peer recovery groups where they train people to be able to support others in recovery.
That's really great. Yeah, because it's all about working together and creating that network. So that's really important. I'm glad you have such high praise for this website. So, and then next we have resources for meetings, which John, I'll let you take over because you know all about these. We'll start off with the AA meetings list. I know there were certain things that people need to know about this, so I'll just highlight this for you right here.
Yeah, so for AA meetings, one of the things that you'll see, if you want to click on maybe one of those online meetings, like maybe the Day Starters group, you'll see, does it say there? Sometimes you'll see that meetings will say that they're closed. Yeah, well, location temporarily closed. But if it says that the meeting's closed, all that means is that it's closed to anyone who does not have a problem with alcohol or drugs. If you have a problem with alcohol, it's open to you. It's a little confusing, especially now with locations being closed and things like that. But that's if it's a closed meeting, that's what it is. But at this website, as you can see, you can narrow it down by town, by day, types, where if you want to look for a young people's meeting, a women's meeting, and then there's different styles of AA meetings. What I like about AA is that there are meetings everywhere. I had one person, he was going to Myanmar to go back home, and I was like, all right, maybe this is the one time we're not going to find an AA meeting. But no, in Rangoon there was a meeting once a week, so there literally are AA meetings everywhere. And one of the things about AA is, traveling is always a big thing. But if you're in the airport and you've been to AA, one of the things you can do is go up to and you're thinking of drinking. If you go to one of the desk people and just say, listen, I need a friend of Bill W. to come here. Bill W. is one of the founders of AA. It's a way that they can broadcast that over the intercom system. And it's a way for people, there will be someone else in recovery in the airport, and they'll hear that, oh, a friend of Bill W. is needed, and someone will come over and talk to you.
Wow, so that's like a secret code word. That's something you can use. That's pretty great.
Bill W. is definitely a secret code word.
Yeah, so that's really great because you'd think that I won't be able to travel because what if I have I'm tempted or I have a relapse. That's really great to know. I had no idea. So I didn't know about this, that there was a database of resources here too. So this is really great. And I'm glad that they specify which one's online and which one's temporarily closed, because people, like we mentioned earlier, I can't imagine like somebody who's just starting or thinking about making a change. Like if they already didn't have a support group before the pandemic, this is something that they can look into to at least have options.
Yeah, and the Connecticut sites has been better than New York on keeping up to date on those.
Mm-hmm.
New York is good, but just Connecticut seems to have, it's been easier for me to find what meetings are working in Connecticut as compared to New York.
Mm-hmm. And then we have these other resources for meetings, and let's just pick one in the interest of time to talk about. Which one would you like to talk about, John?
Well, let's do the smart recovery, just because that one is not banned by Yale New Haven.
Yeah.
Look at it. But smart recovery stands for the self-management for alcohol or addiction recovery training. So it's a cognitive behavioral based. A lot of their meetings are led by CBT therapists. But because it's also self-management, they have a lot of information online for people to follow up on, to do things on their own. And they were, before the pandemic, they already had a lot of online meetings, which people would have to do, because before the pandemic, there was only 2 meetings in person near here. And that was in West Haven and Hawthorne, New York. So they're more known to be online, but they're a very good resource of just looking at what is your the action, behavior, and consequence, and being able to start, all right, what do you need to do to change these things, change these behaviors.
Yeah, so smart recovery has been described to me as an alternative to AA for those people that would prefer to try something different. So this is definitely something worth looking into. And a lot of this is on these, you can find a meeting on here. You can also join the online community here. So it seems like it's pretty, for somebody who would not know what that is, this seems like a good resource to find out more. So, and these other links we're not able to show you right now, but these are, again, other alternatives to AA that have their own websites, that have their own descriptions, and have worked for some people. So definitely worth looking into. And we have come to John's slide on just the Addiction Recovery Center in general. Would you like to take it away, John?
Sure. So we work with people who are wanting to stop drinking or stop using drugs. We are an abstinence-based program. Most people have tried to cut back on their drinking before they come to us. So we do offer, our first level is our intensive outpatient, which lasts for about 4 to 6 weeks, where people come in 4 days a week for 3 hours a day. And it is intensive in that a lot of times people come in, I think one of the most courageous things people ever do is walk through our front doors that first time, because it takes a lot of courage to do that. And then no one's ever wanting to come into our program, but then when they're finishing up the intensive outpatient, they don't want to leave because they really enjoy the experience, that they've had a chance to learn to look at their life and learn how to live, start looking at things in a new way and reframing how they live their life. So from there, people can step down to our outpatient group. That's not as time limited. So some people are there for, it meets 2 days a week for 90 minutes a session. Some people will be there for 2, 3, 4 months. I've got one person, he's been in my group for about 5 years now. And that's just part of his support network. And then people can also step down to our continuing care group, which is meets once a month or once a week for 90 minutes. And again, it's not time limited. We've got another person, she's been in that one of the continuing care groups for 6 years. But as I said earlier, my ultimate goal is I never want to see you again. I want you, however much programming you need, so when you leave here, you can live the life you want to live. That's really one of our goals. We do have a psychiatrist as the director of the program. So he does meet with people who are in one of these groups, and they can receive medication-assisted treatment. And we also offer family therapy sessions, and occasionally we're able to do some individual, where it's something we're expanding on right now.
So is this the typical sort of programming that you'd see at other recovery centers, or is this special to this recovery center?
The intensive outpatient is one of the ones that a lot of other programs just offer an outpatient group. The other thing that is different for us is that we also have an evening program doing the exact same thing. So we do have people that are working during the day and then come to our programming at night. And that's something that's not offered by a lot of other agencies.
Might be more helpful, people are getting out of work, have more time in the evening to actually attend. So that's really great.
Yep.
And I can see also from the website that you have, and also we have a link right here up to their virtual open house. We don't have a lot of time to get into the recovery center, but they had explanation with the other staff members of the recovery center. So you can definitely check out this video in your own time. But I noticed
me
also
again.
that they, in conjunction with whatever programming you are in, you also get medication assisted treatment, as well as family therapy sessions that can also be available.
Yeah, and right now we're doing the diagnostic assessments are in person. After that, our groups are mainly through telehealth. We do have some that are in person or partially in person, partially Zoom, just because we do feel there's for some people in person helps in their recovery, being able to have that face-to-face contact.
So in the interest of time, we can edit out this later, Al, if we have to, but is there anything you want to mention for management during people who are in lockdown right now or can't get out of their house for those support resources?
I would say you can look at that Annie Grace 30-day experiment as one way to look at cutting back on your drinking. And each day she has something where you look at what is it that alcohol does to your life. There you can start looking at, maybe if you're having, try to, what do you need to do to cut back on how much you're drinking, or, so that it's not having as much impact on your life. Maybe try a non-alcoholic beer or something like that, or if you're having a drink, have a glass of water in between, so that you're not. A lot of times people are just drinking because it's a habit, and so if they're able to do something else, that they realize, all right, I don't need that.
Yeah, keeping yourself busy. Yep, essentially. All right, well, we went a little bit over time, but I appreciate everybody for attending and viewing. Please sign up for any future webinars that are upcoming. You can do it from here, the Greenwich Hospital events page, or by calling this number. And I've had other pre-recorded webinars, and on my website, again, that's the link for it, and it'll be on this page under webinar recordings tab. And tonight's webinar on alcohol abuse will be in the where to find series section down here. And you can also check out the other webinars that I previously given. I just want to thank one more time, John, for joining us tonight and bringing your valuable insight into today's webinar. I'm sure a lot of people who will view it will really appreciate it. So thank you.
Yeah, if anyone, you can see my number down there. If anyone has any questions, feel free to call me.
I think they certainly will. So we're going to stop for tonight. So have a good night, everyone.
Thanks, Veronica.